Dr. Ende again discussing Dr. Epstein's article on hairline lowering. I would agree with Dr. Epstein that the hairline lowering is truly an amazing procedure that really can round out the female hairline, lower the female hairline. But there is a select group of patients who undergo a hairline lowering procedure who still need some hair grafts into the corners. We can certainly lower the hairline in almost any patient, but the corners don't necessarily come forward or fill in with a hairline lowering procedure. I would agree with Dr. Epstein. In the past 5 years, I have been transplanting patients in their corners approximately 3 months after the initial surgery. And we did discuss this in my original article on hairline lowering, and I'm glad that Dr. Epstein has and agrees with this technique and is doing the same thing that we've been doing for a number of years now. In addition, it is a great procedure. Basically this part is the treatment options section. In that section, again, Dr. Epstein talks about progressive loss and that patients with that should not be done. I would disagree with that. Again, I've mentioned that before. Certainly they are not the ideal candidate, but they can certainly be done, and understanding the fact that they may need a treatment in the future to correct that. In addition, one thing that Dr. Epstein does discuss is the fine line scar. Most patients do have a fine line scar afterwards, but it's very hard to find. And I've been seeing many of my patients who have had the procedure years and years ago, and we have a long track record now of these patients. In fact, just the other day I saw a patient who had the procedure 2 years ago. She's certainly very happy and wants other facial cosmetic procedures at this point. But I actually could not find the scar. Of course, I know there was a scar there because I'm the one who did a procedure about 2 years ago, but it is absolutely impossible to see her scar. And this is not an uncommon occurrence. Many patients have imperceptible scars to the point where you cannot see them no matter how close you look, even with a magnifying glass. So I would disagree with Dr. Epstein's statement, or his blanket statement, that all patients have a fine line scar afterwards, because through my vast experience with this procedure and seeing patients and getting excellent results, not everybody has a scar in the long run.